Hello everyone and welcome to Aydınlık Gelecek. I'm Yiğitkan Kızlar and today I have the incredible honor of speaking with one of the leading scientists in cancer metabolism research, Professor Matthew Vander Heiden from Koch Institute at MIT. Professor Vander Heiden's groundbreaking work on how cancer cells use nutrition differently from normal cells has opened up new possibilities for developing treatments, including childhood cancers. And I'd like to first thank you, Matt, for coming here today. This is such a great honor, as I said.
Oh, very, very happy to be here. Yeah, thank you.
Thank you. Could you please introduce yourself to the audience?
Sure. So as you heard, my name is Matt Vander Heiden. I've been working at MIT as a professor for the past 15 years. I originally trained as a physician scientist, meaning I got an MD degree. I continue to see patients in the clinic. I actually see oncology patients, although I see adult oncology patients, not children. Um, but I spend most of my time doing research, and I'm very passionate about connecting new science discoveries with how we can reduce the burden of suffering and cancer because, certainly we need more work when it comes to cancer.
Sure. And then I'd like to ask you the first question. And your work on cancer cell metabolism offers like great hope for developing new treatments. And how would you think that these discoveries can be applied specifically to like different cancers, I would say?
Yeah. Uh-huh. Yeah. So I'll say like, yeah, you know, understanding metabolism, I think, really influences treatments in different ways. So I think the first thing is that I've been very fortunate in my career to a few of the discoveries that we've made have actually led to new treatments, and in either case, where we're actually setting out specifically to say, I want to treat this specific cancer. It really came from a discovery that was made and it turned out, hey, this suggests that this particular cancer might be treated with this drug because it identifies a specific pathway or target that would be, beneficial for someone in that particular cancer context. But I think the other way that really understanding the metabolism of cancer cells influences how to think about treatment comes down to the fact that some of the oldest drugs that we've had, in fact, the chemotherapies that we use, which are the bedrock of treating most childhood cancers, many of them actually target metabolism, right? We think of them as being just toxic compounds, but some of them actually have targets, and the targets are very much in metabolism. But yet we don't really understand where those drugs work or where they don't work. And I think if we could better understand why the drugs work the way they do, who they help, and more importantly, who they don't help, we could then better select patients. I think the last place that understanding metabolism, I think, offers hope for new treatment is we also know that some of the other stuff that we might do in our lives, right? What foods we eat and whatnot, they might actually influence how well a drug works. They might make it work better, they might make it work less well. And lots of people are very interested in this, right? Should I change my diet because I'm being treated for therapy? Many people just do this because you know, things that they read about. And I can tell you, I get those questions a lot, and we don't have very clear advice in most cases. And I think some of that is also another thing. I know that if we could get some of those lifestyle choices right, that could make a big difference in
Mhm.
potentially make a big difference in the outcomes of how well some of our drugs work.
And as you said, like cancer can feed differently than normal cells to different people. Like each person can have a certain type of cancer. And from a scientific perspective, like how would you explain that briefly to our like parents and younger kids
Yeah.
watching the video?
Yeah. So I think a place to really start with this really comes from what most people know about, and that's because we have a test like FDG PET scan, which many cancer patients experience that really measures the increased glucose uptake that many cancer cells do. Now, lots of tissues in our body use glucose. However, cancer cells tend to use a lot more glucose than most normal tissues. But unfortunately, cancer is also not entirely unique in that respect. Our brains also use a lot of glucose as well. And I think that makes it challenging to simply say, hey, I'm just going to cut all sugar from my diet and that's somehow going to starve the cancer, because I think if you get that low enough, that could also affect other tissues like the brain. But nonetheless, what I think some of our research is telling us is that every single cell in our body, every single organ in our body has a metabolism that matches the function of that organ. Okay. And so the brain needs to use nutrients in a certain way, which involves a lot of glucose because that's what helps the brain work. Our heart uses different nutrients as a way to support the constant pumping of the heart. Cancer cells, when they grow, they also will choose to use the nutrients that help them most grow. And those nutrients aren't necessarily the same nutrients or used in the same way that would help the normal organ function. And I think as we've tried to best understand what determines the lifestyle, the nutrient choices that each cancer cell makes, what we find is number one, different cancers make different choices. But the choices cancer cells make really are a derivative of where those cancers came from, but they're also somewhat different. And I think that's what actually gives us the most hope, that if we can better understand those differences, it might first explain why, say, some of the chemotherapy drugs that we give, which do have some toxicity but can also lead to cures, why they actually work. And so maybe we could better select patients. But also, that's also been the key in the places that I've seen and where I think in the future for us to choose a new target that might be something that we can go after down the road.
Mhm. And like speaking of the future, in your opinion, what would you say like is the most promising area of research or like technological breakthrough that we might see in childhood cancer treatment or any cancer treatment in the next like 5 or 10 years?
Yeah. So I'm going to pick a couple things here. All right.
Mm,
I think really building off of the research that we've been working on and doing, um, much of the last 20 years of cancer research has really been focused on, can we understand the genetic mutations in the tumor and can we better match patients based on those genetic mutations?
mhm,
And that has been fantastic and it's led to a lot of exciting new discoveries and improvements in treatments. But I think what we're learning now is that those mutations are also heavily influenced by the environment that the cancers are in, including the nutrients that are available, which can come back to things like what foods you eat, what tissue the cancer is in, what specific things about the cancer. And so I think there's a lot of research right now and really trying to understand how the genetics of the cancer interacts with the local environment of the cancer. And I think that has led to new therapies like immunotherapy, which is game changing for some cancers, but not all cancers. But also other ways to think about new treatments. To me, I think that's going to be a big deal for both childhood cancers and all cancers. But I'm also going to say, I think some of the biggest advances that we're going to see in the next 5 to 10 years in childhood cancers specifically is that while we need work on, there's many childhood cancers that we can't cure. It turns out we actually cure a lot of children of cancer, which is a very hopeful thing to know, right? I mean, every case is individual, but the survival rate of many kids for specific cancers is actually quite high. However, anyone whose child is going through cancer treatment or person who's going through cancer treatment knows it's hard. And that can lead to lifelong toxicities and lifelong things that can, continue to persist 10, 20, 30 years after the cancer treatment. And I think what we're learning now is that maybe we can get the same success in cures, but do it in a less toxic way that leads to better longer term outcomes. And I think that's where we're going to see the biggest advances in childhood cancer, not just about the number of kids that we're able to cure, but that the kids that we do cure are going to be able to live lives with less side effects for longer periods of time in the future. And to me, that's actually quite exciting.
Yeah.
I think the kids
And
who are being treated now are going to be the first beneficiaries of that.
yeah, I totally agree. And like, what would you say, like you researchers, fighting cancer is not only about labs and clinics, as you said, but it's
Mhm.
also about like raising awareness and building hope.
Mhm.
And what do you believe that the next generation should do differently to advance cancer research even faster, or should they just follow this already built path?
Well, I mean, there's two answers to that question, right? I think if one wants to make an impact in any field, you
Mhm.
have to work within the confines of that field, right? It's very hard to say, hey, I'm going to go do something that no one's ever done before and have anyone take you seriously, right? So I think you have to work somewhat within the system. But with that said, I actually would encourage anyone who's out there who wants to make a difference in cancer to do something different, right? Um, Look, if we knew how to cure cancer, we would have cured cancer, right? So at some level, you have to ask questions a little bit differently, right? The questions that everyone else is asking, those questions will be answered, and some of them will be impactful and some of them won't. But if you want to accelerate progress in cancer, number one, you have to recognize that it's okay to ask new questions, try new things, and not everything's going to be successful, but that's not necessarily bad. Now, pushing on an idea that doesn't work, that's bad, but trying something new and really asking questions and viewing things differently, in my mind, is the most important way to accelerate cancer research. When I was your age, I was told that, the immune system could never be used to fight cancer. Well, now that's obviously a ridiculous statement, right? We know the immune system can cure people of
Yeah.
cancer in ways that were not curable before. And that's because someone had the courage to pursue that idea and think differently about it. And I think that is really thinking differently is how we're going to make progress. And it's going to take lots of us thinking differently, but also doing good science to actually get there.
Okay. And then thank you so much. That was all that I had to ask today. And thank you for like joining us and sharing your knowledge and answering the questions and most of all spending your time.
Uh,
I hope that it went well for you too.
Yes, I'm very happy to have helped. I want to thank you for doing this and raising awareness of cancer and sharing this podcast with all your listeners. So thank you.
Thank you.